Okay, I think we'll go ahead and get started. This might be a quick call today, y'all. I don't have too much to cover, but I wanted to give a lot of chance for you all if you've got campaigns that you wanted to share or hot news. I wanted to give a lot of time to that today. And also just time for you guys to ask questions if you have, anything on using any of the features or setting up groups or anything like that. And I can, do some demos around that. So first thing, I wanted to make sure that you all remembered about the resources page. So this link, and I will copy it and put it in the chat right now, is a great place to start if you've got some questions. We tried to put together the setup slides into different sections, so it was easier to find those. So I'll just go over here. So like if you've got questions around the messaging center or what participants see or the admin setup, we've got kind of them parsed out. Right now, we're working on the directions for the coaching section and for the data report section. So we'll have a few more slide decks added probably in the next month around those. This right here, this link here gives you a cheat sheet on how to order anything online. So if you need to renew your portal, so you've got an annual fee that you need to pay to renew your portal, you can do that online. You can also order digital books or print books there. If you are interested in purchasing a bulk number of print books and having them all shipped to one place, you'll need to do that through the Arthritis Foundation store. So just let me know if you need help with that, and I can connect you to Nick Turkis, and he can to guide you through that. The metrics, so this right here is basically a PDF showing all the possible questions that we have in our current list of questions to include on your baseline or your post-program survey or your evaluation survey. So if you wanted to look at those kind of outside of your administrative view, it just makes it easier to kind of go through it and read those. This is the portal shortcut direction. So this is a document that you can share with portal participants on how to create a shortcut to the portal and save it on their on their smartphone or their tablet. So there's directions there. Yeah, Jody, you have your hand up.
Yeah, hi everyone. Serena, question with I like being able to see the questions in this form, which is especially great because in New Hampshire we have an ACL AOA grant to kind of crosswalk what are the questions that they require us to be doing. But I'm wondering about phone numbers. And I know phone number is collected, but I'm not seeing it in the metrics pieces. And maybe this is for a different conversation, but it's been interesting to see we're getting people that are signing up, and we're doing mostly the self-directed enhanced, but then they never show up for a class. And so we want to be able to call them and be
Yeah.
like, hey, like let's put a face and a voice to the class information. But we're really struggling with getting the phone numbers to be able to pick up the phone and call.
You're because you don't have it in your baseline database. Is that what you're saying in your search?
Yeah, yeah. So when people when I look at the question chooser, phone number is not one of those options.
Okay.
And so I think, isn't it something where to text with a portal, they have to opt in, but I can't see individual phone numbers unless I'm missing it.
Right, right. So you'll have to, and let me show you. I think we have, and whenever I am sharing my screen, my computer slows down to a snail's pace. So, okay, let's go in. Let's take a look. I thought that we had phone number in there, but if we don't, that's something that I can add. And then you'll just need to make sure that you enable it. Okay, so we don't have phone number on here. Last 4 digits. So I can add phone number as a demographic question, and
Perfect. Thank you.
then what you'll need to do then is go in and make sure you add it as visible.
Yeah. Yep.
Okay, I can do that.
Awesome. Thanks.
Uh-huh. All right. Let's see. The other thing that we have here is the link to our YouTube playlist for the recordings of all these calls. So as soon as we're done with this call, I'll upload the recording from this into this folder. So I'm going to go ahead and click on it so that you can see what it looks like. So it's a playlist of all of the quarterly portal partner calls. So you can see, there's a number of them on here. A lot of them do go through demos of the different features. So I know that sometimes seeing a slide deck that we have giving the directions is different than actually seeing it. So I'll probably go through here and maybe add a little something to the description that tells you what we demo in each of those calls. So you can kind of fast forward to, like, if we demo the messaging on this call, then you'll be able to see that that's where you can see the demo of that. So I'll add that to my list too. Um, so any questions about that resources page, or do you have suggestions for additional resources that would be helpful? And if you don't right now, that's okay. You can email me.
So one question that comes up for me, and I think some of our folks that have been using the portal are struggling a little bit with the setting up the coaching groups. And and if this was reviewed in one of those other videos, let me know when because I know I only just started joining this group.
Yeah.
But we're able to see, is it people who, because we're noticing a lot of people started but didn't finish the registration. And so if they didn't finish the registration, would they not show up to be added to a coach?
Right.
Okay.
Mhm.
All right.
Yeah,
That might be,
exactly.
I think that might be a little bit where our issue is. And then again, that's where the phone number would become handy to be able to call and be like, hey, did you actually, like, let's figure out how we can make this an easy process, because we have gotten some feedback that people see the questions, they're like, no way. So
Really? Because you have
yeah.
too many questions that you're
Yeah.
asking. Oh, shoot.
Yeah, they don't want to give all that much information. But if we get them in a class in person and we do the papers on, like, do hand papers, then they're fine with it. So
Is that
it's really kind of,
interesting?
I think a lot of our folks just aren't all that comfortable putting personal information online.
Sure, sure. I get that. Yeah. And you can reiterate that that's why there's the
Yeah.
login process. And I know that that doesn't ease a lot of people's fears. So um yeah, absolutely. If they do not complete the registration, then they won't sign up, or they won't appear as a participant.
Okay.
And yeah. So like here where you add participants to this coach, um, give me a second to have the list come up. So if I expand this list here, only the people who have completed the registration will show up on that list.
Okay.
Yeah. Yep. Okay. This is great. Other questions? And remind me, Jody, are you working primarily with an older adult population?
We are, yeah. We partner with Emily Bird from DHHS, but
Yeah.
I'm from the AHEC, the Area Health Education Center. So we've
Okay.
got some older adult population, some with we've got folks that have severe and persistent mental illness, so they especially are not having luck using the portal, but
Yep.
they're
Yep.
doing it through an agency they're already established with. So we're
Okay.
doing hand copies there because they already have all the data in their electronic medical record.
Great. Great. And we are, it's on our wish list of things that I hope we'll be able to tackle this year, to have the ability for an administrator to enter people, to enter
Oh,
multiple
cool.
people. I mean, right now they can do it just, by creating kind of their own process of tracking an email and a password and a login and that kind of thing, and creating an individual account for each participant. But what we're wanting to be able to do is say, have a participant who has filled out the paper form maybe, and they've got 10 of those, and so they'll be able to enter on the admin side all the data, either upload it from an Excel sheet or just hand enter it from those paper forms, so that that kind of helps bypass the online survey barrier, and some of the registration barrier, but that people can still benefit from getting those weekly emails and text messages to keep them going. So
Yeah, well, count us in if you want to partner to pilot that system.
great, good, good, awesome. Let's see, is there a list of all the participant YouTube video links? There is, and Carla, I'll find that. So all of the weekly videos were created by our partners at University of Missouri Cooperative Extension, and I'm sorry, it was a group, the Oregon State University, South Dakota State University, and Delaware University put together those videos in collaboration with the Arthritis Foundation. And so the Arthritis Foundation hosts all those on their YouTube channel, and then allowed us to embed those videos into the portal and into our weekly emails. So I will put that list, I will find that list on the Arthritis Foundation's YouTube channel and share it with you all. Okay. Great questions, everyone. This is great. I'll pop back over to the agenda real quick. I just wanted to make sure that you all knew that we did launch that text to log feature. So I'll show you. Let me go ahead and log out as my person here. So now when your participants, if you haven't seen this, you may have already seen this, but when your participants first go to the registration process, or to the registration page, they will be able to opt in to the text to log feature. So this is what it will look like right now. So you've got, I think I showed a screenshot of this in the email. So now we have kind of this whole section here for communication preferences. So the motivational messages, this part right here, is they can opt for text, email, or both. And so this is those weekly messages that go out to everyone. So either you're using our kind of standard template that's already preloaded and is kind of the default message, or you've adapted it for your clients or participants. But that's what that is right here, this motivational messages. So if somebody does opt for the text version of it, what happens is they'll get a little snippet text, and then there will be a link, and that link opens up into a page that has the full email content on it. So rest assured that if somebody opts in for just the text messaging, they'll still have access to the complete email message. So that's what that piece is. And then this text to log your walks is the new feature. So as you all know, people forget to log into the portal, forget to, or don't have the time, or struggling with logging their walking in the portal. And so this allows them to get prompts through their phone that will basically guide them to enter how many minutes or how many days they've walked. They can do it daily. And if they do it daily, then that basically means that each day they will receive a text that says, how many minutes did you walk yesterday? And they can put 0 or they can put 400. They can answer with whatever, but all it is a number. And that automatically populates the data in the portal. So you as an administrator will see that they've entered that, even though they've just entered it by responding to a text on their phone. For the weekly messages, it's a little bit different because they'll ask 2 questions. They'll ask, how many days did you walk last week? And how many minutes did you walk last week? So they'll get two separate texts. If they answer that they walked 0 days, then they won't get the question about minutes, because that'll obviously be 0. So as I mentioned, this is an opt-in sort of thing. So they are not going to see this unless they opt into it. They'll have to select one of these, either daily, weekly, or not interested. So that is that. And of course, when they select that, then the phone number piece pops up down here. They are allowed to change these preferences in their profile at any time. So let me show you how that is done. So I will go to and you can do this too if you are getting, maybe you're getting notifications each time somebody registers for the program and you don't want to get those notifications. You can adjust that in your settings in your profile as well. So you just come up here and you click on your name, and then you can see you can unsubscribe from any of the emails. You can change how you get the weekly messages. You can request a summary once a day instead of getting, regular emails. So maybe your coach is texting you several times per day, but you only want to receive once. You can do that. So these are all, possible to change in your settings. So that looks the same for you as an admin and for your participants as well. Let's see, I see there's a chat. Is there a plan for a Walk with Ease app at some point? So an app, although many people like the idea of an app, we have done some work at the OA Action Alliance with other apps, and it ends up being really costly to build it, to maintain it. And then we haven't had the kind of, it's like one of those, if you build it, they will come. It's not necessarily true. So it's something that we're still playing around with. There still seems to be a demand for it, but we just don't have the funds right now to build an app for it. Okay, so let's see. Jody, does that answer your question? Okay, sorry. Okay. So that's kind of it on the text to log. Is there any questions about that? Okay. It is super slick. Like I tested it and three of my colleagues tested it out as well. We had some people doing it during the day or doing it weekly, some people doing it daily. And rest assured that people aren't going to get those prompts like in the middle of the night. We have them so that they only go out from, I think it's from 9 to 6 Central Time. So if a message is sent, either from the coaches or those, prompts to log their walking, it's not going to hit them at kind of an unreasonable hour, hopefully. Let's see. So any questions about the text to log? Everybody feel good about that? I really hope you all start to see more walking data in your reports. Let me double check this. Yeah, Candace, awesome, great, good, okay. One other thing that I wanted to, I'll just pop back over here, is I keep logging out of my participant and logging into my admin. I should just have an incognito page opened up, but oh well, I'll do that next time. So one more thing I want to go over from an admin perspective is making sure that you have the group set up to pull your books appropriately. Because we have noticed that some people think that people have access to the books and they don't have access to the books. So I just want to confirm that everyone knows how to set up their groups. So this occurs in step 3. Just a reminder that this first one is kind of an ongoing, rolling, self-directed. If you don't want to have an ongoing self-directed, then by all means, all you have to do is close this. And to close it, you just click on edit and you make sure that active is not checked. So if you want this ongoing, rolling, self-directed, make sure it's active. If you don't, make sure you go in and click this button so that it's not active. The other thing, so this is I'll show you this for this one and for the custom groups below. If you are not assigning a number or actually you can do it even if you are assigning a number of books to a group, make sure that you have pull selected because that will make sure that it's pulling from your book inventory. So if you've got 20 books assigned here, physical books, you'll need to make sure that you have at least 20 books in your physical inventory to pull from. But basically that means that if you pull from that inventory, once you have hit a number in your inventory that won't allow you to pull those physical, then the physical books will no longer be an option for that group. So it's kind of a check and balance way of making sure that you never overpromise a print book or a digital book to someone if you don't have that in your inventory. So make sure that you do that for each of your groups that you have active. So all of these, most of these here are just test ones or example ones. But like for this Camina con Gusto, I can go in here and I assigned a number, but I can just pull from my inventory to make sure that I have enough for that group. Does that make sense to everyone? I just want to make sure this pull feature is is clear. Okay. Another thing that you might want to check is making sure that you have you're allowed to buy and allowed to decline set up the way you want it. So I'll just come back to this rolling self-directed here. So let's say that you have 50 books left and you do a marketing campaign and all 50 books, are cleared out within a week or two. You can allow people to continue to register, but they can have the option to buy their own book. And basically what happens when that is enabled, so if you click that and allow people to buy their own book, is that then they will, if they click buy my own book, they will get a link to the Kindle version of the Walk with Ease ebook in Amazon, which last I checked was, I think, $7 or something like that. It fluctuates, so you might want to just double check that. And they'll also get the link if they want the print book to the Arthritis Foundation store, and they can order the print book through the Arthritis Foundation store. Obviously, if they want to try and find the print book on Amazon, they can do that as well. But those are the two options that we give in allow to buy. The allow to decline option comes in particularly useful if you are going to give the participants a book in person. So say you're registering a group of people at a YMCA and the YMCA has 20 books on hand, then you would set up your group to just have the YMCA name, and then you would not have any books, and the only option they would have is to decline a book, because you're going to give them a book when they sign up, or when they attend the workshop, or when they sign up for the workshop at the Y. So you don't want to have them get an ebook or a print book, and then also get one handed to them from the YMCA. So that's kind of an instance when you would want to allow them to decline. They might also have already taken the workshop and already have a book. So in that instance, maybe you want them to be able to decline, or you have a lending library set up and, people check out the books from you. Then you would want them to be able to decline. So just make sure as you're going through the setup of this, that you've got it, set how you want it for each of those pieces. Questions on that? I know it can be a little bit wonky, and that's what happens when you start adding all these customizations. Yeah, Karen.
So I have a quick question, because we've been talking to partners about using the portal, but encouraging them to, promote recruitment about 2 weeks in advance to give participants time to get the books. So if I'm creating a custom group on here, I could have the start date for the registration start like today, but the campaign messages not start till like 2 weeks, and that's really when the class actually starts. So it gives them that time to get the book in, right?
Yes.
Okay, perfect.
Yep, exactly. Yeah, and so that's here, I'll go ahead and show you all. So this is what Karen's referring to, this campaign. So the start and end date here is, as Karen mentioned, a registration period. So it's not the start and end date of the workshop. So you're going to open registration, say you're opening it today, you're going to have registration open for 2 weeks, and then the class starts the following Monday or something like that. So you would select your start and end dates for your registration period. And then you want everybody to get that week 1 email at the same time. So you would, you can just give them the default, or if you have other campaigns set in here. And you would just make sure that you select, okay, everybody's going to start this on, Monday to the 23rd or whatever. And you can put that in here. So it is separate from the start and end date up here. Yeah. Yeah, Jody.
So with the okay, Karen, your question prompted my thinking. As we assign people to coaches, like at AHEC, what we're doing is we're setting up, for the most part, a new class starting each month. So it's like there's February walk with these, March walk with these, all self-directed, and then. But after the class starts, we want to take them off the active list so it's not confusing for participants as they try to figure out like which, if we have 10 classes that are listed at the same time, that gets confusing for folks. But once we make the class inactive, do they lose their ability to be linked to the coach?
No.
Okay.
Nope. Yep, they'll always have their portal, and that is kind of separate from the registration piece. So they'll be able to log in, they'll be able to talk with their coach and everything, even if that class isn't showing up on your registration page or whatever.
Okay, because I think I had tried to go in and assign somebody from a past class that was no longer active and they didn't show up in the list to give the coach at all.
Oh, yeah, I think if you've made it inactive, I don't know that you can then assign them after
Okay.
you made it inactive.
But once they're assigned while the class is active, they stay with the coach.
Yes.
Okay. All right.
And that's my understanding. I'm going to double check but like if they were a part of a class that's no longer active, then you can't assign them after it's no longer active.
Okay. Yeah, like for example, what we wanted to do with February, we had 5 or 6 folks who signed up, nobody showed up, so we wanted to bump them to the March class. And then but when we tried to assign them to the coach, because I think by the time we set up the March class, I had deactivated the February class. So I couldn't get those people into the coach to be able to send the messages and communication.
Okay. Okay. I'm going to double check. I'll
Okay.
double check with Sarah. Yeah. Yeah.
Okay. Thank you.
Great questions, y'all. Okay. What else? What other questions do y'all have? This is super. I've gotten a lot of questions about URLs lately, so I'll go over here. So in step 1 of the partner settings, so this is where you can upload your logo and those types of things, release waivers if you're using them. So if, and this can be a little bit confusing. So if you're doing both a Spanish and an English portal, you can't just hop back and forth from your login page. You have to kind of come all the way out of the portal and either enter where it says here, switching between English and Spanish. So if you're going from English to Spanish, you need to make sure that you grab this URL that's in your step 1. Or you go all the way out to startwalkwiththese.org and click on Espanol and then log in. So I know that some of our admins have created accounts so that they can see both Spanish and English. And so they'll log in to the Spanish portal with their English user and they'll see like this Spanglish page that makes absolutely no sense. And you're like, why is half of it in English and half of it's in Spanish? And that's why, because you have to like kind of all the way back out of your system and come back through with the Spanish login. So rest assured that if you have given your participants, and here's the Spanish. So if you scroll down on that step 1, you can get your okay, so here's your URL for English. It's under the how to use. If you're in English and you need to click switch to Spanish, back all the way out and then put in this URL. And then if you are promoting your Spanish portal, you come here to the how to use Spanish, and this is the URL that you provide. Okay, so it's a little bit wonky, and part of that is good and part of that is bad, but it has to do with our browsers, and our browsers are there to help make things easier, and they try and kind of anticipate our needs and go to places that we used to be in the language that we're usually using. And if you're trying to force it to be in a different language, you have to kind of go through some additional steps. So I do recognize that this URL right here for promoting the Spanish version is not nearly as user-friendly as this English version right here. So I suggest maybe a bit.ly link or something like that to shorten it and create a user-friendly version. Or also just, using a QR code or something like that to get to it. But all of those, if you want to, embed this widget right here in a website or something, here's the code right here. If you want this, start walk with ease button on your website, here's the code for that. So you can just copy that code and you can put a start walk with ease button on your website. So that's where you find that, just in case you ever need to access that easily. It's in step 1, your partner settings. Okay, let's see. Other questions? Look back over to this. Okay. How about anybody doing any fun marketing campaigns or anything? I know that this is here in North Carolina, this is kind of perfect walking weather time of year before it gets too hot. So this is a good time to like do a spring campaign, or like get ready for summer, walking type thing. Anybody doing anything like that?
Yeah, we have one of our team members making a campaign for the fully self-directed all about summer. So
Oh,
I think she's got different ads that will run every month on Facebook and Instagram. So just kind of, how to, just summary themes. She'll graduate from college in December. So we're trying to take advantage of all the young folks on the team and
yeah.
their creative graphic inspiration, since they are the ones that are on social media the most and they know what tends to get people's attention.
Awesome. Oh, if you would be willing to share those, I'm sure everyone would love to see
Yeah,
them and
yeah,
not reinvent
absolutely.
the wheel. Yeah, that would be great.
Yeah, I'll put our Facebook link in the chat here so anyone can, like, you can see she creates all of the content there for our Wellbeing Action Network, which is really pretty cool. If you don't have Canva yet, get a Canva account. That's our advice.
Right? We use Canva all the time at the OA Action Alliance, for sure. Yeah, Carla.
Hey, Serena. Quick question, and anyone else is welcome to chime in as well. But so I signed up, and as you know, we're looking to maybe get this through the orthopedic clinic to patients to get started. And when I first signed up, and it gets you into the portal, and you have like the first thing you see on the upper left is like, what are your goals for this week? And then there's the video and you have to click through to get to the chapters, and there's a few different resources, and it's all a lot of great tools. But my initial impression was some concern that our patients may get a little bit confused on exactly like where to start, how to get started, that sort of a thing. And I liked the email that came out. But does anyone have had their participants like need guidance on really getting going and how to best kind of overcome that initial barrier about where to get going if they don't want to have the time to read all chapter 1 from the get-go?
I think that's a great point, Carla. I haven't heard of anyone struggling with that yet, but we could certainly think about, I mean, and I'm happy to have kind of suggestions on different ways for, I don't know, setting up that week 1 maybe so that it's a little bit more intuitive. Has anyone else had any challenges with that?
That's fine. I didn't know if in our setting it was any different than how others are getting people started with self-directing. If there was more like contact through these campaigns or groups or whatever, or if it's literally like, here's the link and have fun.
Yeah, so I can respond to that. Carla, what we're doing in New Hampshire, we are promoting the self-directed for people that want to do the whole process completely independently. So we're not really getting any feedback about week 1, but we're also doing a lot of pushing of the self-directed enhanced. So finding that if people are signing up, granted, our big struggle is right now that disconnect between signing up and actually showing up. But something that we started to do, and we had, I think, only 1 or 2 people last month, but we're doing monthly info sessions. So we also offer chronic disease self-management, chronic pain, and we're adding a few other SMRC programs. But we're having one during the lunch hour and one at 5:30 on different days of the week every month, where people can just come and see like what the heck are our programs all about. And so our next one will be on May 30th at 12:30. So it's an open Zoom that we've got flyers that we kind of are promoting different places. So if people are curious about the portal, or if maybe they tried and they're like, what the heck is this thing? Then we'll be able to walk it through with them and make it a little bit more real and tangible, and just instead of just an ad that they see on Facebook.
Mm-hmm. Mm-hmm. Yeah. I wonder too if so Carla, there is on you're able to set up a custom page on your website. So you could, I'm just thinking about kind of what we have on our custom page. So for a participant, you could make that custom page say start here or something like that. And you could just say, start by, reading chapter 1 of your guidebook, and then setting your goals for this coming week. And that could be all they have. So you could make this page right here say, start here, in all caps or something like that. So on ours, this is what everybody gets after they have registered. This is kind of the page that they see. And we just added it as an important reminders here. But you could do something like that. Start here and then have, step 1, read chapter 1. Step 2, set your goals for the coming week. And the book the book leads them through that process. So if all you want to say here is just start by reading chapter 1, they'll kind of get a feel for the flow of things. Does that help at all? Yeah, okay. Great. Karita, I see you've got your hand up.
Yes. Oh gosh, it's good morning. We're almost there. Yeah, what we're doing, we are fortunate that we have an organization that we're working with our diabetes prevention program. So they have made arrangements for us to do some community recruitment. So we will be, for example, we'll be at the Urban League this week. We'll be at a senior residential facility this week. We have some urgent care locations, as well as the public libraries that we're scheduled to visit to do recruitment and sign up. We're scheduled for May, June, and July. And then also we have some additional funding that's coming down through the Diabetes Prevention Program, which Walk with These is a coupling program for that, to do a community health fair. The community health fair is going to be at sharing the location space with this, a senior health center. So that's going to be really helpful. And another great marketing strategy that we're going to utilize. I was at a training and someone had the QR code on the back of their t-shirt. I was able to just walk up and just scan the back of the t-shirt. So we're going to QR codes on t-shirts and give those away as incentives. And we also are using Canva as well to get some of that marketing out. Thank you for allowing me to share.
Great. That's great. I haven't seen that. That's a good idea. Let me know how that works, Karita. I would love to hear about your t-shirt QR code. That's cool.
Yeah, absolutely will do.
Yeah. Very neat.
So in Oklahoma, we've been really trying to work with people on understanding Walk with These, a lot of our partners. And so March or April, Serena, we had you out virtually to do an implementation call, which really helped people understand the portal better and how to use it. And then since then, we've been meeting individually with each of our partners to talk about really who they plan to work with. We've seen a lot of people start partnering up. We have a lot of county health departments that are going to partner with like tribes or with hospitals. So it'll be one person teaching the class one day a week and our person teaching the other day. So really excited that Walk with These is setting the stage for some great partnerships to come about and see what that looks like. So I think June is the month when we're going to have a lot of people start pushing this out. So we're excited about that. We did have one group, and I really think it's because it was rushed and they just didn't fully understand it. Here in Oklahoma, we had the memorial run in April, and there's a senior marathon component to it where the seniors, they walk a lot of miles beforehand and then they finish the last mile the day of this marathon. And so they wanted to use Walk with Ease as the curriculum for it, which seemed like a really great idea, but the coaches were new. And so they had some people that were, walkers every day. And then they had some that were new to walking on a more regular basis. So they had a hard time managing their groups and meeting the needs of everyone that attended. So that was something we talked about, in the future. If they want to do it again, really kind of thinking about either the marketing of Walk with These or having two coaches helping. So if you do have a group that walks more often, you have someone that can work with them versus individuals who maybe are trying to get back into it. So that was an interesting learning curve and something we definitely want to think about next year.
Yeah, I can see. I have heard about classes like that where you've got some people who walk all the time, and then there's some who use walkers or something like that. And it is hard unless you have multiple leaders trying to meet all those needs. Yeah, I think those are some great strategies for addressing that. You could even have a beginner Walk with These and an advanced Walk with These or something like that. But yeah, the marketing is going to be key for that kind of thing.
Yeah, that's a good idea. And we do have some hospitals that they have some walking groups that are already happening, but there's not a lot of structure to it. So they're going to use these groups already in place and bring walk with ease into it. So we're interested to see kind of how that works out.
Yeah, yeah. Absolutely. I do think that, sometimes people think Walk with Ease isn't going to be appropriate if there's already a walking group, but there's so much more to Walk with Ease than just walking that I think it can really add another dimension to those existing walking groups. I think that's great. They can learn more about, goal setting and behavior change and stretching and strengthening exercises and overcoming barriers. So that's great. Awesome. Anybody else have some great campaigns or motion activities going on? Okay. Karita, did you have another comment, or is that still from your hand from before?
Oh, let me lower my hand.
Okay, I just wanted to make sure I wasn't ignoring you. Okay. All right. Well, goodness, we ended up filling up the hour here. That so often happens. So we'll do our next quarterly call August 12th at noon again. And this time I will send out a save the date for that. I have a number of things on my follow-up list. So I will add the phone number to the question chooser. I will send you the list of the YouTube videos on the Arthritis Foundation YouTube channel. I will also probably will pull together. No, I'll just add it in the descriptions of those of our quarterly portal partner sharing call videos. I will add which demos we do so that if you need to re-see a demo in action. And then I will double check Jody on the assigning coaches and whether you can assign them, if they registered for an inactive group. So
Great. Thank you.
we'll check on all the things. And as always, let me know, just email me if you've got any questions or if you need a demo for partners or anything like that, I'm happy to do that. All right, y'all. Well, let's see. Hang on. I'm going to check the chat one more time. Okay, there's Jody's Facebook page. Awesome. Okay. For this group, great. Awesome. All right, y'all. Well, have a good rest of your week, and I will be in touch soon. Bye.
Bye.
Hey, everyone.
Thanks for your participation.
Bye. Thank you.